Hello, everybody.
Hello.
We're just waiting for people to join in as we are admitting them in the webinar. Probably we'll just wait for a minute more and then we can start.
We see that people are still joining, Satish, so maybe we'll give 2 to 3 minutes.
Okay.
Thank you.
Hello again, everybody.
Hello.
We're just waiting for a minute or two more as
No.
people are joining in.
No. Mm. जो ठीक है
Hey. Yeah, I see people still.
Audio ahora reactivado.
Okay, maybe we'll start now. Good morning and good afternoon and good evening to all and everyone who's joining us today. To introduce myself, I'm Satish. I'm the head of program for ATscale, which is the global partnership for assistive technology. I'm joining in here from Geneva in Switzerland. On behalf of ATscale and United Nations Office for Disaster Risk Reduction, it's my pleasure to welcome all of you in today's webinar, which is focused on leveraging assistive technology for disaster risk reduction and climate action. We are holding this discussion today in observance of International Day in memory of the victims of earthquake. A moment that reminds us of the urgent need to ensure disaster preparedness and response efforts are inclusive and ensure that they reach everyone. Disaster and climate change continue to impact population across the globe. Often, they are persons with disabilities or aging population or people with pre-existing health conditions and others, and often due to barriers in accessing early warnings, evacuation, and essential services. Assistive technology can play a critical role in addressing these gaps. It enables access to information. It supports in mobility, in communication, and helps to ensure that people can act
Audio
quickly
ahora reactivado.
and safely in time of crisis. Simply and directly put, it can make a difference between life and death. Yet, assistive technology is still not consistently integrated into disaster risk reduction as well as in climate action discussions. Today's webinar builds on a joint policy brief which was done by ATscale in collaboration and partnership with United Nations Disaster Risk Reduction Agency. The name of the policy brief is Leveraging Assistive Technology for Inclusive Disaster Risk Reduction and Climate Action. In today's webinar, we'll take a bit of a deep dive to understand the contents and the findings of the policy brief. We'll see some of the challenges and good practices that were identified. And hopefully, this policy brief can trigger and encourage action towards more inclusive and resilient systems. Before we begin, just a few housekeeping notes. The webinar will run for 1 hour and will end at 11 a.m. Central European Summer Time. The session is being recorded and will be shared publicly after the event. Please keep your microphone muted all the time. Interpretation is available. International Sign Language is available, and it's on the screen. In addition, live captioning is available in English, French, and Spanish. Please click on the link in the chat to access the live captioning. Towards the end of the webinar, we have a question and answer session. Alternatively, you can share your question at any time during the webinar. We have team members who are monitoring the chat, and they will respond in real time or during the question answer session. If we are unable to respond to your questions today during the webinar, we'll follow up individually with you after the webinar. Please also use the chat function to provide any general comments or feedbacks you may have as we move forward in today's webinar. With this, let me first invite our first speaker, Ola Abul Gahib. I must admit, I know Ola from very, very long time, and probably this is the first time I'm using her family name. Ola is the director for the Global Disability Fund, a multi-partner trust fund that is hosted by UNDP and supports disability inclusive action across humanitarian and development system in over 100 countries. Ola brings her extensive experience in global policy, financing mechanisms, and inclusive development strategies. And also thank you, Ola, for joining at such an early hour for you. Over to you, Ola, please.
Thank you. Thank you so much, Satish, and thanks for colleagues at ATscale and UNDRR for inviting us to such an important discussion. And I welcome everybody, as Satish mentioned, to join us for this very important debate or discussion or recommendations to countries on how can we move this agenda forward in an inclusive way. My name is Ola Abul Ghaib. I'm the director for the Secretariat for the UN Global Disability Fund. As Satish indicated, we mostly support countries in terms of implementing their commitments on disability inclusion across key thematic areas, including climate action, humanitarian response, health, and integration with education systems, urban development and inclusive cities, and equality when it comes to girls and women with disabilities. Today's discussion is very central, and I would like to focus my contribution on the learning that we have seen from countries we have funded on the ground when it comes to integrating and mainstreaming disability inclusion across sectors, with the focus of what do we see on the ground in terms of making sure that climate action in terms of preparedness, response, and recovery is systematically and continuously considering disability across the different cycles. I strongly believe that countries are still in need for further guidance. That's why this policy guidance comes in to complement the key instruments that countries are in need for to understand what is needed, but also look into opportunities and making sure that there is an interconnection between the different pillars of systems. As all audience know today, that disability cannot be addressed at country level in siloed approach. Fragmentation is not helping practices and interventions when it comes to disability. One key element that is continuously confirmed from countries, and we see that AT is a central part when it comes to the holistic picture addressing disability inclusion. It is a must to be integrated when it comes to looking into health education, climate action, looking into the future of where we are all going in terms of inclusive development. This guidance note comes very timely because in many cases, countries are still not aware about the importance of assistive technology when it comes to looking into what preparedness they need to look into about disability and intersection with DRR processes, but also when it comes to response as well and recovery later on. What I found very interesting in the guidance note is the connection between understanding the gaps, but also looking into the opportunities. We can't always stop of understanding the gaps, although it's essential, but governments also needs to understand what they can do to make a difference in the lives of persons with disabilities. One key highlight in the guidance note that we are reminded all the time that it is not an afterthought to make sure that participation and engagement, in this case, the users of AT and persons with disabilities, are central when looking at those instruments and systems level. But also, we need to make sure that equity is addressed. So women and girls with disabilities across the investments, the interventions needs to be also sensitively looked into. One key element in the recommendation, which I really also believe is important, which we can't undermine, is that coordination and interconnection is very key. In many countries we see on the ground, there is also linkages, weakness when it comes to connection between ministries, between systems, between coordination mechanisms, even between disability actors. And when it comes to AT, we know in most countries around the world, the responsibility does not lie into one ministry alone. So this issue of importance of integration, coordination is very central. People with disabilities cannot afford, and persons who needs AT, to be left without their lifeline of connection of AT to function. And that's the case in situations of stability, in crisis, in broader well-being. And that is why I really also believe that investments, financing instruments are also very key. GDF continues to be committed to funding countries through a holistic approach when it comes to disability inclusion. And we are always cautious that the work on AT is central to all our work, and we very much welcome the continued collaboration with partners like ATscale to make sure that is also considered and is taken into the broader picture of transforming disability rights and conditions at countries we operate. I wish you all the best with the rest of the webinar. We remain committed to look into this agenda within the coming 5 years of the Global Disability Fund, and we look for further collaboration with colleagues on the call and beyond. Thank you so much.
Thank you, Ola, and thank you for your commitment and also highlighting the importance of financing and system change and meaningful collaboration and co-design, and also your emphasis on access to lifeline assistive technology. Your emphasis on aligning resources with inclusive approaches really sets the stage for today's discussion. Thank you very much, Ola, again. I now invite Talal Wahid. Talal is the Global Disability Advisor at the United Nations Office for Disaster Risk Reduction, UNDRR. He brings an extensive field experience working on disability inclusion in disaster risk reduction and humanitarian action, particularly in some of the world's most crisis-affected contexts. He has been involved in advancing inclusive disaster risk reduction and brings deep expertise in integrating disability inclusion from policy to practice. Talal will walk us through the key findings of the policy brief, including the challenges, gaps, and recommendations. Over to you, Talal, please.
Hi, everyone. Good day, and thank you so much for joining us today. As introduced, I'm Talal Wahid, and I'm based here with UNDRR in Bangkok Regional Office for Asia and the Pacific. Today, I'm speaking about leveraging assistive technology for inclusive disaster risk reduction and climate action. This is in the context of the International Day in the memory of victims of earthquakes, which is being observed for the first time today. This presentation draws on the policy brief developed jointly as introduced by Satish and also talked about by Ola in collaboration with ATscale and UNDRR. It's highlighting key evidence, gaps, challenges, opportunities, and good practices concerning assistive technology users, disaster risk reduction, and climate action. My goal today is threefold: to share what the evidence tells us, to explain why this issue matters now, and to highlight what needs to change across systems. I'll begin with the global evidence. In 2025, on the next slide, please. Yeah. In early 2025, UNDRR and ATscale conducted the global survey. We engage around 300 stakeholders spread across 90 countries through global surveys, interviews, and consultations. Importantly, more than half of participants were assistive technology users themselves, including persons with disabilities and older persons. These findings also build on existing previous surveys on disability and disaster risk reduction and confirm that long-standing gaps persist. One figure illustrates the short proportion of small proportion of countries integrating assistive technology as an integral part of the emergency preparedness regulations and policies. Before we dive deeper into the evidence, I would like to draw our attention towards everyday usage of assistive technology and their users. On this slide, you will see an image depicting a person using assistive product, walking along a rural path carrying firewood. This reminds us that the assistive products are not special items alone. They're localized solutions sometimes, and they're tools for mobility, dignity, independence, and livelihoods long before disasters occur, as well as during and post-disaster. When these tools are disrupted, people, lives, and their everyday routine is also disrupted immensely.
Talal,
Now
I'm
let's
sorry.
turn.
I'm sorry.
Yeah.
I think we need to change the slide. Or
Karen, could you please change the slide to the third one where it shows the picture?
Done.
All right. So, sorry, guys. So, this slide actually depicts the picture, and now we move towards the next slide. The picture has been explained already, so I will turn towards people told us directly through this study and highlighting some of the key insights from the global survey. The study actually reaffirmed, as mentioned, some of the existing challenges, but also there were new challenges and opportunities highlighted. Let's talk about those. Most of these circle around the reliability of assistive products and their applicability into everyday life. There are exacerbated problems highlighted and which are extremely worsened during disasters. The concerns about cost, lack of information, and limited availability came repeatedly. Some key findings share that only 13% of assistive technology users had their assistive products fully meeting their needs during emergencies. Only 9% experienced failure of their assistive devices during a disaster. Only 23% felt emergency provided assistive technology was appropriate and specific to their needs and the local context. This is the important point, and it will come again in the opportunities and challenges and recommendations at the system level. The weaknesses are really clear. Nearly half experienced difficulties with maintenance and repair, and only 15% had access to adequate local services. Many participants described assistive technology provision as fragmented, inconsistent, and poorly coordinated, as Olaf was also hinting about that. This has very real consequences during hazards. On the next slide, we will see again a visual grounding. The image is showing a person using a manual tricycle navigating a flooded street. It illustrates how hazards interact directly with assistive products and mobility, especially when infrastructures fail and services are disrupted for many people. For a few, the hazards do not only slow mobility, it completely stops that. And this becomes a big challenge for assistive technology users. Next, I will summarize some of the challenges using their own opinion, and these are the voices coming from the respondents of the study. The first major challenge is loss and damage of assistive product during evacuation and response. One participant described their devices breaking during evacuation with no way to repair or replace it, leaving them fully dependent on others. The second challenge is limited access to repair and maintenance. As one person puts it, maintenance becoming a luxury. And when something breaks, people either retrofit or stop using it altogether. Another challenge that was highlighted was inaccessibility of the infrastructure and assistive technologies not being designed for rough terrain or flooding, quickly becoming unusable, leaving people unable to move safely. The next set of barriers link with the communication and inaccessibility of early warning systems, and also identifying issues around dignity and affordability. This should be on the next slide, Karen. The barrier mentioned here talks about inaccessible communication and early warning systems. Some respondents saying they never received warnings and in the format they could understand, and the sirens alone are ineffective. There are also serious psychosocial impacts, fear, anxiety, and harm caused by not knowing what is happening or having no one to explain the risk and the loss that is going on in the surroundings. Risks and distractions, financial barriers are also severe. One participant described waiting several months to replace a damaged crutch after a cyclone, simply because they could not afford a replacement. On the next slide, this is the last one listing voices and challenges from the field. Many assistive technology users depend on support networks, and this includes family members, community support mechanisms during disasters. During the emergencies, these support systems may be disrupted or discontinued or unavailable completely, leaving people without help for movement, communication, or daily activities. Participants also highlighted stigma and lack of awareness particularly for invisible disabilities, which leads to exclusion from preparedness and response planning. Others also spoke about intersectional risks, including lack of privacy, safety, and appropriate support in emergency shelters. And critically, data gaps remain very much highlighted where AT users are not identified in assessments and lack of national data, increasing invisibility and exclusion of persons with disabilities. So what needs to change in light of these challenges and voices, in light of different systems and actors? Next slide will show you the recommendations that are listed and organized by different actors. The policy brief document in detail that you can also access through the provided link, and the QR code shared in this presentation will give you a detailed overview of the recommendations clustered under different stakeholders. Here, I wanted to introduce some of those which are critical. For instance, for governments, it is critical to embed assistive technology across disaster risk reduction, climate action, early warning, preparedness, and social protection systems. Humanitarian, DRR actors, and climate actors must integrate assistive technology into assessments, coordination, stockpiling, and inclusive response planning. Donors and development partners should finance assistive technology through dedicated budgets, clear indicators, and anticipatory financing mechanisms. Assistive technology users themselves and organizations of persons with disabilities must be at the center, leading, co-designing, preparedness, monitoring, and accountability grounded in lived experience. Health and rehab stakeholders should ensure the continuity of provision, fitting, repair, and follow-up during crisis. And private sector and research actors should co-design durable, context-appropriate solutions, strengthening the evidence base and providing solutions that are locally suitable, and where AT users are involved hand in hand in not only using but also monitoring the services. Before I close, I would like to highlight on the next slide the key priorities and call for action. First and foremost, assistive technologies access is a recognized right. It's not an optional add-on. Secondly, inclusive prevention is not a luxury. It is a necessary, and it starts with addressing foreseeable risks before emergencies occur. Assistive technology can save life in emergencies, but only when combined with other inclusion measures and integrated systems, not treated as a last-minute response. Assistive technology is both a humanitarian and a development priority, supporting resilience and independence in daily life. Governments must ensure assistive technology is available, accessible, and affordable for everyone who needs it. And finally, assistive technology users must lead, supported by the political will, sustained financing, and genuine system change solutions across to disaster risk reduction, climate action, health, and social protection. All these services must be co-designed, having leadership of organizations of persons with disabilities and those people who may not be part of any OPDs, but individuals with disabilities. I'll close with this key message is that disasters do not discriminate, but exclusion does. Failing to include assistive technology users put lives at risk, and inaction is simply not acceptable. I thank you all for your attention, and I welcome your discussion and questions in Q&A. Thank you.
Thank you, Talal. And your message on exclusion is not acceptable is loud and clear. And also, thank you very much for clearly laying out the urgency as well as the opportunity which is there in this space. For me, what stood out was that what you mentioned on AT saves lives in emergencies. And AT assistive technology is not a luxury, but a necessity. Inclusive DRR and climate action must begin with proactive measures that protect assistive technology users from foreseeable risks and disruptions. The gaps you highlighted also points to the need for stronger coordination across different sectors and your emphasis on context-specific actions. Thank you very much, Tanal. I'm sure there will be few questions, and we'll come to them towards the end of the webinar. But thank you very much, Tanal. With this, let's move to the perspectives from the field, for which I have the pleasure of inviting Mr. Pushpak. Pushpak is a rehabilitation professional with many years of experience across both humanitarian and development settings. His career spans in emergency, disasters, conflict, and post-conflict context in Southeast Asia, as well as in Middle East. He has been directly involved in many humanitarian responses in different parts of the world. Pushpak expertise lies in strengthening rehabilitation system and services, especially in low resource settings. Over to you, Pushpak, please.
Thank you. Thank you, Satish. Good morning, good afternoon, and good evening to everyone joining the webinar. I'm Pushpak, and I'm joining all of you from Lao PDR, where I'm based as the Regional Rehab Specialist for Humanity and Inclusion. Humanity and Inclusion works alongside people with disabilities and individuals living in situation of exclusion, poverty, crisis, and disaster. Over the course of next few minutes, I wanted to share, the lessons that I have learned personally responding to a number of crises, but also the experience of humanity and inclusion responding to a number of crises in the years we have been working across the world. The emphasis of my presentation is on the importance of integrating assistive technology as a part of disaster preparedness. And I would want to share, the impact of having a timely response, because having access to AT can have a big impact. Over to the next slide, please. And this picture captures very well what I wanted to share. In the picture, you can see colleagues of mine and me. This is 9 p.m. on 25th of April 2015, the day when the big earthquake hit Kathmandu Valley. At 9 p.m., the earthquake was at 12 in the noon, and by 9 p.m., we are here at the major hub hospital in the capital Kathmandu, assembling an emergency wheelchair, which was part of our contingency stock. And you can see we are using the headlights of two cars because the power supply was yet to be back, but we were there because we had our ATs ready. And we were able to respond the same day. And from the next day, on day 2, we were spread across 4 major hub hospitals, able to respond to the need in the hospitals. Next slide, please. This is the fact sheet that was released at the end of year 1 of the response. HI was able to reach out to 6,000 plus survivors out of the 22,000 people who were reported to be injured by the earthquake. And on the right bottom, you can see we were able to provide 4,700 assistive products to people in need by the end of the year. But also, apart from these numbers, what is important is the time, the importance of timeliness. And this is the emphasis of my experience. In a disaster response, on a large scale one, what is important is timeliness. In terms of health and rehab, timeliness could make a big difference in saving lives and limbs. If we are able to respond in time, access to AT could make a big difference in saving life, and also, making a big impact in achieving a functional outcome for people who have been injured because of a disaster. HI was also, the reason I am talking about the response in Nepal earthquake is because I lived through that experience. But also, we can share with you that HI was able to do this evaluation of, the earthquake preparedness project before the earthquake, 3 years before the earthquake. As a part of a consortium funded by ECO, HI was preparing for the earthquake, and where we were able to invest on the AT ecosystem. And when I say AT, I'm talking about the products, but also, the 5 Ps, the personnel, the system, the procurement system, the policies, and the provision system. So HI was able to invest on all the five elements of AT before the earthquake. And what we learned from this experience is that, integrating AT and doing structural preparedness can prevent disability. If I go back to the numbers, but what I remember is that, at the end of the response, we had anywhere around 50 to 60 people with amputation. And if you go back and compare with other big earthquakes, that's a small number. So which means having access to AT and having a system that is prepared to respond, we could save a lot of limbs. And also the other learning from the response is that, if preparedness is done well, we can, as humanitarian responders, as governments, as a stakeholder in response, we can make sure that, future responses can be successful, and we can save a lot of lives and reduce the impact of the disaster. Over to the next one, please. Why AT matters? These are something that we know quite well. Having access to AT means having mobility, being able to participate, take care of yourself, and in a situation of a disaster, having access to the service and aid that is being made available. So the person could move, have access to those services. It reduces exclusion, helps to enhance or improve, dignity of the person, but also in long term, it can contribute to participation in economic activities, being included in the society. So these are something that we know quite well. But what I would also want to add is that, AT can save life. And the next slide, I can talk a little bit about how AT can save life. This is from the minimum technical standards developed by WHO, and this graph speaks quite well, the impact of sudden onset disaster. So if you look at the red dotted line in the graph, is the need of rehab, and you can see after a sudden onset disaster, the first few weeks is the period where the need is very, very high, and this is where you can link it to preparedness. If a preparedness activity is well done, if AT is integrated into preparedness, the service providers, the first responders, the responders after the disaster will have access to AT that can have a significant impact on the outcome of the response. Beyond this graph, what I can also tell you from my personal experience, when we talk about rehab, you think about, post life-saving medical surgical intervention. Rehab is seen something as after this. But from experience, we can say when a disaster happened and in a mass casualty scenario, in a triage area where most of the people injured are brought into a hospital setup, rehab can contribute by saving time for the medical surgical team to take care of the most complex emergency cases. Rehab team can take care of the green cases, the people who are mildly injured, who can walk but still need intervention. And when rehab teams with AT take care of this huge caseload, the medical and the surgical team can dedicate their time dealing with the severe injured cases. And this is how, directly AT access can have an impact on saving life of people. Over to the next one, please. And the experiences that I'm sharing is, yes, from the Nepal earthquake 2015, but humanitarian inclusion has worked on different other crises, the earthquake in Pakistan, the one very recently in Syria, but also in the situation of, conflict and displacement, Syria, the ongoing crisis in Myanmar, Gaza. The 2025 earthquake in Myanmar is a recent one where we had, response done for the earthquake in Myanmar. So the key message, if you go to the next slide or the next click, you can see that, AT cannot be thought of as an add-on. It cannot be thought of after a crisis. You cannot start thinking about AT after the crisis has hit, because it will have a very big negative impact on the outcome of the response. So the key message over here is to make sure that AT is integrated into the emergency humanitarian architecture. All the different elements of AT is taken into consideration into the preparedness work, and that will be a key to make sure that a response is successful. Over to the next one, please. Then when we think about, this disaster context, a situation of crisis and displacement, it automatically moves to a low resource setting. Most of the countries in a low resource setting are the ones who suffer most. And the reasons are the health systems are already weak in this context, and the supply chain are in a very bad situation. So we have to think about this if we are going to make a good response. The capacities of service providers is very limited. The number of service providers are limited, but also the skills and the capacity is limited. So this is something that is going to come up as a challenge. There is a high cost when we talk about rehab and AT. It's something that has a cost, and there are lack of financing mechanism. This is something that has to be looked into when we talk about preparedness and response. And then when this crisis hits country which are in a low resource setting, there are disruption, and a conflict, a displacement, and a natural disaster will cause a massive disruption into an ongoing system. Even if there is a system in the country, is going to be massively disrupted. So these are something that needs to be considered. Next one, please. So what should we look at? So we should be looking at, as I talked about, the whole ecosystem of AT, and in the feedback that was received and Talal talked about, we need to invest on the local system. So the training of local technicians, clinicians, staff is going to be key. But also, if you think about AT, it's a long-term care. So you have to invest on local repair hubs, local workshop. If you talk about prosthetics that you see in the picture, a prosthetic user is going to use a prosthetic throughout their life. So what you see in the picture is a young girl, and she would need changing a prosthetic every few years. So we need to invest on the local system. So that's a key message over there. Developing local manufacturing. When we talk about AT, it could mean a wheelchair, it could mean a basic mobility device like a crutch, and some of those could be produced or manufactured locally or at least regionally. This is something that needs to be looked at if you want to make sure that the supply chain system is looked at. And then the other key message is, when large scale disaster happens, so a sudden onset crisis, it cannot be managed by an NGO or a development partner. It has to be in partnership with the ministries, the governments, and NGOs. So these are the key messages. If we go to the next click, we will see. So if you want to make sure that the response is sustainable, the services are accessible, we have to look at investing locally, including the infrastructure, but also the skills. Next one, please. Then, because we're talking about AT, and supply chain is going to be a big part of AT. Some of the common challenges that we see in AT, if you go to the next few clicks, you will see that there is a disruption in access. A sudden onset disaster like an earthquake or a tsunami. Imagine the destruction that happens to the road, the airports, the roads getting blocked. In-country mobility is blocked. If it's a conflict, the security situation is another problem that leads to difficulties to reach hard to reach areas. So this disruption is going to impact the supply of ATs. There is bound to be challenges and delays in the logistic and the transport system. So that has to be looked at and prepared for. And then some of the ATs that we are talking about needs customization. Prosthetics, wheelchairs are items that needs to be custom fit to the user. And for this, we need to look at, the components, the human resource side of it. So in terms of solutions, in terms of preparedness, the lessons that we have learned is the importance of contingency stock. The 2015 earthquake in Kathmandu, we were able to respond in the same evening at 9 p.m. We were there with the wheelchairs because we had a pre-positioned stock inside the capital in the valley. So we were able to respond on the same day. But then most of the time, this is going to be a small stock. So there has to be backup. So, at that time, we had our pre-positioned stocks in Dubai and in Lyon, where our headquarters is. And that was our backup supply. But in the recent example from 2025 Myanmar response, we had the support from ATscale and UNICEF. We received the AT kits in country and we were able to respond. So, these are the mechanisms that needs to be looked more into. And then, the importance of local system, the local production and supply chain system. I think we need to look at it in the earthquake in Nepal and different contexts. If there are, the local production hubs for, prosthetics, wheelchair, I think we need to strengthen them. Next one, please. So, there has to be a cross sector collaboration, the government, different departments, different sectors of health, education, social protection have to work together. The UN agencies have to work together with local NGOs, but also, using the professional associations in country. I think everybody has to work together to make the response positive, successful one. So collaboration will help in accelerating, but also will have a big impact on sustainability of the response. Next one, please. And these are the key lessons that we have learned from HI's experience. Early integration of AT is going to be key if you want to save lives. Collaboration is going to be key. We alone cannot do it. So it's very, very important to collaborate for scaling up and making sure that the actions are sustainable. I talked about it, but I cannot emphasize less on this, but the importance of pre-positioning and contingency stock, especially in the case of AT, is going to be very, very important. Training of local workforce is going to be key for the long-term impact. And then, I think what we have learned over the years is that we need to learn from our each experience, having data, and using that data for, evidence-based advocacy on improving the quality of response for the future is something that we need to invest on. I think that's it from my side. Next slide.
Thank you.
Thank you.
Thank you, Pushpak. Thank you very much. And your insights really highlights the operational realities, especially the importance of preparedness and local system strengthening and ensuring continuity of care for assistive technology users during the emergencies. Thank you very much, Pushpak. Our next speaker is Tulamsuren Jigit, a disability rights advocate and an executive director of the Culture Center of the Deaf in Mongolia. Tulamsuren is actively engaged in disaster risk reduction, leading local capacity building efforts on early preparedness for deaf communities across Mongolia. She brings important perspective on inclusion, particularly from the standpoint of lived experience and community engagement. Tulamsuren will be communicating with us through International Sign Language. You will be able to hear the voice interpretation from our wonderful sign language interpreters. Over to you, Tulamsuren.
Sorry, to make sure that everybody is able to hear me and see me clearly.
Yes.
So thank
Yes,
you
we
very
are,
much.
Samal.
I will now speak to my interpreter. My name is, this is my name sign. I'm a woman, but you hear the voice of a man because the interpreter is a man, but I'm actually a woman who's speaking, just as a visual cue to everybody. So thank you very much to UNDRR and the ATscale for this very important meeting that you convened us this afternoon. I've been following, and it's really wonderful to follow this session in the morning and to see what the research that have been done and the policy that are in place, which are really robust. And I think we have a lot to benefit from this. And thank you very much to Kola for the points you have shared with us. It was really Ola for the points that you shared with us, which is really pertinent. So myself, I represent the OPD and organizations of persons with disabilities. So I feel that from my perspective, what's important from the OPD's perspective, and to present some maybe information, what is being said, I will not repeat, but I will probably just highlight some things from the perspectives as well as research that we have done, and perhaps also look at some of the gaps that in terms of the data that we have, to present our perspectives. From a deaf person's perspective, especially with women, with the intersectionality that we're looking at, we see that in 2024, actually, we have actually trained 20 or 50 deaf individuals on early disaster preparations. And during this training, we found a very concerning trend, as most participants have actually never received any disaster preparedness information prior to that. So this is the serious gap that I wanted to highlight, because this is not only in terms of access, but also in awareness and inclusion. So what's really important is to see that at a systemic level, such challenges persist, and because inclusion is not yet fully integrated into national disaster risk reduction systems, and therefore current efforts are very insufficient. Well, we understand there are collaborations between governments and organizations of persons with disabilities. Significant gaps remain. Just want to check the interpreter is able to see me. Yes, the interpreter is able to see you very clearly. So at the globe, so for this example, I think one experience that I want to talk about is this. We heard just now from our speaker, Tala Wahid, who has spoken to us. Tala Wahid has told us about the data gap that we are experiencing at the national level. So I think for us as an OPD, we know we have all this data in hand, and in terms of the disabilities they've experienced, as well as the research that we have done, and the different approaches that we have in terms of how to deal with the situation. In Mongolia, for example, we have done research for health and medical care, and also social security for the people with disabilities. But such data, it's although presented, the government is taking a considerably long time to actually have it approved or implemented. The reason is because such data often it's provided by the OPDs, and these are some of the gaps that the government itself lacks. Second aspect is that this data that we have, it's pertinent and it's related to, for example, deaf people. Because of the language barrier, a lot of information are not provided, and data can also be difficult to be provided to the government because of the communication barrier. And most of the time when these data are presented from a deaf perspective, communication often becomes a challenge, and therefore the gap further widens the gap between what is available to the government and what is provided from the ground up. So, for example, we talk about the 50 people were trained that are trained. Many of them had no training prior to it. So, which means many of these trained people in the past were not able to provide information that are required to in terms when disaster happens or when it's time of emergency. So only after such training was provided, we saw that the understanding of what DRR, disaster risk reduction, is significantly increased. But this is one aspect that we think is really crucial, because what happens prior to this training, what has been done over the years, even apart from lacking in research, it lacks information and lacks a lot of action prior to such initiatives. So I think what's really important, we want to thank the training that has been supported and provided. Another interpreter has come on, and so that he will take over.
Thank you very much. Right now, my voice is going to change since I've got my second interpreter coming in. So just for information.
Right.
Yes. So just a point, since we are just swapping the interpreters, so this is also one of the cases we need to look at, like when we have interpreters, so people need to swap and, they have their own times. So we say that, interpreters are part of assistive technologies, so they are not part of assistive technologies. So they are not assistive technology, they're not part of it, just to get this point across to all of them. So just to continue, so with regard to AT, we need to have a lot of skill training in terms of, like real life experiences. We need to, people with real life experience, they need to train, they need to spread the awareness then during the time of crisis, how we can include these people on an equal basis. So this is a very good example. We have few examples, very good practices. So there's a lot of experiences that we have seen, like examples that I've given about training 50 deaf people. These people have been trained in disaster preparedness before. And in Philippines, we have a big community-based project. If you remember, in 2024, the Asia Pacific conference that was held in Philippines, they had several sessions and projects which is related to climate change and disaster. So during that time, they did not have interpreters due to certain sessions. And even the interpreters who were signing, they were not, having the local sign language. So there was a lot of miscommunication and a lot of gaps which is happening. So we need to see how we can, address these gaps and how we can, like according to the needs of the people with disabilities, how we deliver these kinds of resources. So Talal also said gave a few examples. One example is in Uganda in Africa, where they included people with disabilities in early warning systems in terms of the bomb drills that they had conducted. So during that training and that practice, they had a lot of information that people with disabilities had given them. So right now, the Cultural Center for the Deaf, my organization, we have a TOT, trainer of trainers, where we have selected 25 deaf people and we're going to train them in disaster preparedness and disaster risk reduction. So these 25 deaf women will further train community people. So I think this is a very good example, the trainer of trainers. So people think that it's just assistive technology is just a kind of business and how it's going to profit us. So it all depends. People think in terms of cost, in terms of it's a kind of business opportunity kind of thing. So people, when we talk about assistive technologies, to people, they think that they don't need it. But we need to make them aware that assistive technology is for they have other uses also. So we need to make these people aware of the different uses of assistive technologies. And and spread this kind of awareness through the community. So in summary, so I'm going to close right now. So in summary, I'll just respond to any questions that may arise. And thank you for my interpreters and for everybody to listen to my message. And thank you for this policy brief also.
Thank you. Thank you, Dalam sir, and for those powerful reflections. Your intervention is a strong reminder that inclusion must be driven by the voices and leadership of AT users, persons with disabilities, population who are affected by these frequent disasters and humanitarian situations. And factors such as gender must be central to our approaches. Thank you very much. We will move quickly to the question answer sessions. And if there's any questions, please feel free to raise. If not, I'm going to pick some question from the chat. I will probably pick, in the interest of the time, I'll pick a couple of questions from the chat. And Talal, there's one question which came earlier on in the document, in the policy brief. It does mention that Ministry of Health and Social Welfare are the best entry points for all DRR policies and assistive technology. However, in reality, it is also that these ministries are quite sometimes needs more capacity and may not be very strong on the agenda of disaster risk reduction or climate action, or may not be the central ministry who's coordinating that. And isn't it better to coordinate assistive technology intervention in disaster risk reductions or climate action through other ministries, other stakeholders? So that's the question. Over to you, Talal.
Thank you, Siddesh, and thanks to the colleague who have asked this question. This is a pertinent one. I would say that this is the process that is at its initial stage. If we look at the disability as a mandate, in many countries, we see that the social welfare departments and the health ministries are referred kind of flag bearers of disability as a topic primarily. So then the mainstreaming of all other topics, including disaster risk reduction, is often coordinated through these two, or sometimes in some countries, even one of these ministries. So as we are just starting to promote this point of bringing in assistive technology, maybe I see in the ideal world, it should be disaster risk reduction ministries or the relevant department, however they're titled, to look at assistive technology as a primary right of all the stakeholders. But as things currently stand, all the respondents that we consulted were highlighting these two ministries in most of the cases, if not all. I hope this answers your question.
Thank you, Talal. Thank you. This also clearly also highlights the importance that it's still an agenda which requires dedicated targeted efforts, which could generally be around health and education or social welfare, but also a mainstreaming agenda so that national planning and ministries or ministries responsible for disaster risk reductions are engaged and ensuring that assistive technology is considered into that. So thank you very much, Talal, for that. I see one hand and we'll take that. Santosh?
Yes.
You can keep your questions brief and to the point, please.
Yes. I just wanted to highlight that while talking of integrating the AT and other requirements, we must also highlight and keep in mind the different access needs of different disability groups. While we talk of AT, often it is misunderstood that AT would mean only wheelchairs or crutches. There are different disability groups which require different AT, and so we should concentrate on appropriate AT depending on the disability. That should be recognized. The other part that I want to highlight is as a strategy, we must include DPOs right from the planning and formulation of disaster strategy, disaster management strategy. So these are two comments that I wanted to make.
Thank you, Santosh. Thank you very much. And it's very loud and clear. People with AT users and people who are affected by disasters and humanitarian situations should be involved and engaged right from the start in any actions which are planned with regards to response and preparedness. As well as your point on, context appropriate qualitative assistive products based on the need of the user. I see one more hand, and probably that's the final one. And we will, for the remaining questions, we'll reach out to them individually and respond to them. Nicole?
Everybody, I wanted to know what and are also looking at in terms of first responders to persons who are using assistive technology in the event of disasters. So what I mean is, are we building the capacity of the first responders to recognize that persons with disabilities will have assistive technologies, and how do we have them understand that those technologies exist and incorporate it in their first response? Is it clear?
Thank you, Nicole. Very clear. Pushpak, probably I bring you in here. Essentially, the question is on the first responders.
Yeah, thank you. I think the question is very, very important. And as I spoke about it, when we talk about AT, it's not only the product, we have to look at the whole ecosystem, and the key players are the service providers. So if I go back to the example of, the Nepal earthquake experience, I think we are talking about the importance of preparedness. And preparedness is a process, and you have to look at all the elements. So in the 2015 earthquake and the years before it, in 2012 to 2015, in the earthquake preparedness project in Nepal, there were different elements, and one of those elements was working on the capacity of healthcare providers. So there were trainings for doctor, nurses, rehab professionals, and there were trauma protocols that were developed for in-country. So Nepal had prepared trauma protocols on how to manage amputation, surgery, spinal cord injuries, or any kind of traumatic injuries that happens in an earthquake scenario. And the whole healthcare personnel, doctors, nurses, rehab professionals were trained on the protocol, how to manage. And this was one of the most probable reasons for less number of amputations. The doctors, they were trained to save the limb. Instead of going for straight away amputation, they were trained on preserving the limb, doing the complex fracture management, and the nursing and the rehab teams were trained on the protocols how to take care of those kind of intervention. So I think that's going to be key, and that is something that has to be looked upon when we talk about preparedness beyond the product. Thank you.
Thank you. Thank you very much, Pushpak. I'm afraid in interest. Yes, Kinley?
Sorry, so in the interest of time, we might not be able to take more question, but there is a question that's relevant for Dulam Siren, if she could answer, and I can read out the question.
Please go ahead, Kinley.
Yes. It is still a challenge for us in Uganda to reach deaf people with early warning information using assistive technology. I don't know how Mongolia is reaching to them to ensure they are prepared before disasters strike. Thank you.
Dulam Siren, over to you. If you can keep your response briefly.
Yeah, thank you for that question. Hang on, just want to make sure. Okay, I think globally, I think many countries, the fast response is really not quite there yet. So similarly in Mongolia, we noticed that information are not as quickly and smoothly provided. For example, we talk about the 50 person who was being trained to be able to provide this assistive technology. I mentioned that the deaf people never had exposure to what the AT is in terms of what the phone can be used, and the government has never seen the importance of providing such assistive technology to the people who are hearing, who cannot hear, who are deaf. So I think the point we're going to say now is that for people who are deaf, we really depend a lot on quick response, quick information that provided by people closest to us, and because of many times we know that not all of them also are familiar or know how to use all this technology, and also the second aspect is the data gap that's missing. Or also the term when they have phone and even though they have phone, data subscription or the internet itself may be a cost factor that prevents them from having continuous access to the internet. So I think these are some aspects that we need to think about as how we consider emergency response can be provided. Maybe we could suggest, like for example, we can build a tower whereby there is a light or a siren that provides the kind of alarm system up in the tower, so that people of different communication needs are able to see the or this alert or alarm system. So of course, I think also the considerations who are people who are maybe visually impaired, that could be one obstacle. But I think what's important in terms of emergency response or early emergency system, we need to consider the various all possible means and approaches to ensure no one is left behind. Thank you.
Thank you very much, Tulam sir. And I think your point on ensuring that preparedness is inclusive and if capacity building efforts are integrated in the preparedness plans, as well as that it is not considered as an afterthought, but as considered as a before thought or as a starting point for AT users and AT needs and different population groups needs is extremely important. I've just been asked that if all the speakers and participants can switch on their camera so that we can take a group photo or a screenshot of all who are there in the webinar. So I'll just give 15 seconds to everyone, whoever can switch on their camera so that we can take the screenshot. But in the meantime, thank you very much. I can see in the chat there has been very good questions and comments and feedbacks. We will respond to those questions and individually. But I really want to thank all of you for this exciting intervention and discussion, and sincere apologies for running over time. I also want to take a moment to recognize the contribution of Nino and Praditya, who have been the consultants and engaged in developing the policy. So and I understand are also there in the as an audience as participants for the webinar. So thank you very much, Nino and Praditya. The English version of the policy brief is available online, and the links are already there in the chat. I sincerely hope that we can continue this discussion with all of you on strengthening and ensuring that high quality assisted technology is accessible in a timely manner within the climate action and disaster risk reduction. Thank you very much, everybody. Have a great day and night ahead, depending on where you are. Thank you very much.
Thank you, everyone.
Thank you.
Thank you, everyone.
Thank you. Thank you very much.
Thank you all.
Thank you, everyone.
Thank you.